Hello everyone, this is Vaisha. Whether we're dealing with a conflict zone like Ukraine or a global nursing shortage in civilian hospitals, there is a real need for a more efficient wound care solution. Altrazeal is made primarily of two polymers that are the same as those used in contact lenses. The material is very safe, biocompatible, and when hydrated, it transforms into a non-occlusive barrier over the wound. The barrier is oxygen permeable, it keeps the wound breathing, it stays moist but it allows the excess moisture to flow through it with vapor transpiration, all the while acting as a barrier to prevent contamination. For more exudative wounds, you can simply add more powder from time to time for up to 30 days without requiring primary dressing changes. As the wound heals, the matrix turns into a scab and just flakes away. And if the matrix needs to be removed, you can simply lift it off with a pair of forceps. The idea is that it's not the dressing that heals, but our body, and the function of the dressing should be to provide a good physiological barrier that allows the body to heal itself without disturbing it with frequent dressing changes.
This patient had a venous ulcer. We did the investigations, did the venogram, so where the incompetent perforators were, and we ligated them. After ligating the incompetent perforators, we usually do follow-up duplex to make sure that nothing is staying there. But the patient was not going well during the stage of healing. You can see here that's how he looked after ligating the perforators, and the wound starts to break down, and we did extensive debridement. We started the immunomodulation in the form of azathioprine, corticosteroids, and mycophenolate mofetil. All this did not work much. The problem with that patient too was he was in severe pain. You can see this is the first time we were starting the dressing with Altrazeal. You can see that the patient has his muscles completely exposed with the tendons. Now we will start the application of the drug after cleaning the wound, making a good layer of the drug. Then we will make it wet. You can use either saline, or sometimes we use antibiotic like amikane solution, which is called amikacin. After you start, you can increase the amount of powder where you can see that it's not enough to form a universal layer of the polymer. After we finished applying this polymer, shortly within 2 to 3 minutes, the patient started to stop crying and he felt some relief of pain. That's after the application of the saline. We continued the same thing, and each time if we had any necrotic tissues, we debrided it. And you can see that the granulation tissue is bleeding, and that was actually a miracle. You can see that the bone was starting to get covered by the newly growing epithelium step by step. And you can see that there is really a marked difference in the amount of fullness of the tissues. And here you can see that the bone is becoming just a small island within this nicely growing tissues. And you can compare between the patient at presentation here and the patient after 70 days of the start of the dressing using Altrazeal. We were very happy about these results. We consulted the guys of plastic surgery. They did him split thin graft. And you can see here that the graft was taken nicely. I have never seen anything that did a miracle. Actually, he's a fisherman. Now he's back to fishing. You can see that he has a completely healed wound, and the skin graft has taken very nicely. This drug did really work so perfect. And I'm very happy that we have one more weapon in our armamentarium to combat disease.